you will definitely pause me and walk away because insurance is just boring and sometimes it's a little difficult to understand. When we talk about insurance in a dental office, though, one of the things that dental offices as a business that they really face as a challenge is the fact that most people don't, I shouldn't say most, but a lot of people don't have dental insurance. For most insurance plans, dental is considered an optional, just like vision is. So there's a lot of people out there who don't even have dental insurance, which is a real barrier to them coming in for appointments and things like that. What's going to come at you in this PowerPoint is going to be quite a lot of terms and definitions, so don't panic on me. We're going to do our best to get through them. So let's start this off. So, even though as hygienists, you guys are not going to be in doing the billing maybe necessarily, what ends up happening is that you become the face that the patient knows. So because you're the one that they have contact with, because you're the one that they spend the most time with, you're going to be the one that they're going to trust and ask their questions to, even though you aren't the biller. So there are some basics about insurance that you do need to know so that you can help your patients out a little bit better. And it's when you have an understanding of these concepts that you can help your patient with a better understanding of these concepts and don't accidentally misinform them. But usually when they get a bill from an office, they don't call the billing department, they call the office. And then they talk to the face that they know, which is usually going to be you. So, first, let's talk about the most common types of insurances. So the first one is called an HMO. HMO stands for a health maintenance organization, and you probably somewhere in your life have heard of at least the term HMO. With an HMO, the insurance company pays every single fee that there possibly could be with the insurance, which would initially seem fantastic. The problem with an HMO is that the insurance company chooses what physicians the patient sees. And that's the, stipulation, hey, we'll pay all of your fees, but you have to go see the doctor we choose. And a lot of patients don't like that. If a patient has an HMO and they go see a different doctor that the HMO does not approve of, then the patient is stuck with all of the fees. So, it's called in-network or out-of-network. So, the doctors that the HMO approves of, they have a contract with those doctors. Those are called in-network. It's when the patient wants to go see a different doctor, that's called out-of-network. So, a lot of the times, let's say, for instance, I have an HMO, and they want me to see, the HMO has decided that my family doctor will be Dr. Jaja. It's late, I don't know where that name came from. And I go see Dr. Jaja, and I'm not really a fan of Dr. Jaja, and my friend tells me that Dr. Gabor is awesome, is wonderful, and has the newest technology in his office. So I want to go see Dr. Gabor. So what I have to do is I have to contact my HMO, and I have to ask for permission to go see Dr. Gabor. And the HMO company is going to say, well, why do you want to see them instead of Dr. Jaja? And I need to be able to provide good proof and good evidence and a good justification for the HMO to say, okay. If the HMO says okay, they will issue what's called a referral, and they will send me to go see Dr. Gabor. But here's the problem with these referrals. The insurance company usually dates them. So the insurance company might say, okay, you can go see Dr. Gabor, I will issue a referral, but it's only good from February 1st through February 28th, and it's only good for one visit. Now, as a patient, I don't know this because I don't understand things about referrals. So I call Dr. Gabor's office. I'm super happy, and I get an appointment for March 4th. So the problem is that the appointment is now after the date of the referral, so the referral doesn't help me, and I'm still stuck with all the fees. If I go see Dr. Gabor and I never ask the HMO for approval first, I'm still going to be stuck with all of the fees, and the HMO won't pay anything. So the main issue with an HMO is that the HMO chooses who the patient sees. The patient doesn't have the choice in who their doctor is. So a great advantage is that the HMO covers all the costs of stuff, but the patient really doesn't have any freedom to see who they want. So that's an HMO. The other kind is called a PPO, which stands for Preferred Provider Organization. And PPOs are becoming way more popular because in this case, the patient gets to choose from a big list of doctors that participate with that PPO. So each insurance company, so let's take Blue Cross and Blue Shield for instance. Blue Cross and Blue Shield is the type of the insurance. They can offer an HMO plan and a PPO plan and something called a POS plan, which is point of service. So one insurance company can offer several different types of these plans. So a PPO is becoming way more popular because now the patient can choose. So usually when you want to join a PPO plan, you get a huge book, but now they have them online as well, where you can go see if your provider is in-network. And again, it's the in-network, out-of-network thing. So if your provider is in-network, fabulous. But a PPO runs on something called a fee schedule. So what that means is, if you go see a doctor with, so let's say Dr. Jaja is in my network for my PPO, then that means my visit will cost $50, let's say. But Dr. Gabor, he's outside my network. So I'm going to go see him still. I don't need permission. I don't need a referral. It just means that my fee schedule is going to be a little higher because he's an out-of-network doctor. So instead of the visit being $50, maybe now it's $75. But I can still go see him, and a portion of the visit is still covered. I just have to pay a little bit more. Most patients are really preferring plans like this because there's way more flexibility as far as who you can see. There isn't as much difficulty in scheduling appointments with different facilities for x-rays and things like that. And there really just aren't as many hoops to jump through. So PPOs are becoming way more popular than HMOs. So the main difference between an HMO and a PPO is the HMO, the insurance company chooses the physician, and in a PPO, the patient does. Workman's compensation is a common kind of insurance that every kind of job really has to have. So this is an insurance that you automatically get through your employer that covers you if you get hurt at work. So for example, when I was running our medical office, I was in our kitchen the one day, and we had a water dispenser with one of those 5-gallon water jugs like is in our cafeteria here. So I'm changing the water jug, and for some reason one of my coworkers comes in, and it's first thing in the morning, and she starts screaming, "Hey!" And I thought something was wrong. I turned to look, and the entire 5-gallon jug falls on my hand, trapping my thumb between the jug itself and like that well that it sets in. All she was doing was saying hi, and I wanted to kill her, but needless to say, I was seeing stars, and I was in a lot of pain. So I immediately stuck my hand in the freezer. I grabbed a smelling salt because I felt myself about to pass out. The doctor, luckily I worked for a bunch of doctors, so they looked at my hand. I needed stat x-rays. I needed to go for an orthopedic visit right at that moment. But before I went, my boss had to file a claim through Workman's Comp. So they gave me all these numbers and stuff like that, so that when I went to the hospital, they filed it under Workman's Comp, and I gave them all the claim information. So my job paid for the orthopedic visit and paid for the x-rays, not my personal health insurance. Now, the problem is that some offices don't accept this kind of insurance because it can be a pain to deal with. Workers' comp is something that, unfortunately, sometimes a lot of people fake. So the insurance company itself requires a lot of documentation and information to support the fact that you actually pay for the service. So, for example, there was documentation that I crushed my hand, that it happened at work. There was documentation that the x-ray I had to get done was because of dropping that on my hand, and that the orthopedic visit was a direct result of dropping the thing on my hand. If I started going to physical therapy for my shoulder, well, now they're going to be like, what the heck is that about? She hurt her hand. We're not going to pay for that. So there's a lot of justification that's involved in workers' compensation. You all have auto insurance. You've probably all seen the commercials that it is illegal to drive without auto insurance, which is absolutely correct. So you might have seen, Safe Auto or those kinds of things where you can get like dirt cheap, crappy insurance coverage. The thing that I never knew was that if you get hurt while you're in a car accident, your car insurance pays for the medical bills depending on how good of auto coverage you have. So, for example, I had just graduated my bachelor's degree, and I was 21, and I was covered under my father's insurance, but like 2 days after I graduated, the insurance went, oh, she's not a student anymore, bye-bye. So I had no insurance, and I was in a car accident with my mother like a week later, and when the ambulance got there and they're prying my mother and I out of the car, we were both pretty badly hurt. All I kept saying to the EMT was, please don't call my father. I don't have health insurance anymore. You can't take me to the hospital. I had no idea that the car insurance paid for the hospital ride, paid for the ER visit, paid for the x-rays. I didn't know any of that stuff. I just kept thinking of what a huge bill it would be because I had worked in healthcare and I didn't want my dad to get mad at the bill. So, but your car takes care of that. Another type of insurance is government assistance. So these are the types of insurance where usually someone doesn't make enough money on their own, and the insurance is provided by a government entity. So Medicare is a common one. Medicare is the one for the old people. So when you hit a certain age and you're not working anymore, the government pays for Medicare. So right now, all of us who are working, we pay into Medicare. That's how that works. It's done through the taxes that they take out. The same goes for medical assistance. Medical assistance it was originally designed so that when you were between jobs, you could use medical assistance, and then the idea was you come off medical assistance and you go on to another plan. Unfortunately, medical assistance has had kind of a stigma around it, because it does get abused by some people. But anyway, medical assistance is also offered. So those of us who are working, our taxes are paying for medical assistance to be available. There's also a new one called CHIP. That one is for children. So a lot of the times you might have a mom who maybe she herself doesn't have medical coverage, but she wants to get it for her children, but she can't afford it, so she takes out CHIP, and that covers the kids. There are a lot of offices that don't accept government assistance insurance, mainly medical assistance. Most offices always accept Medicare, but it's really medical assistance and Unison and Medicaid that are typically denied, and the reason is because that there's a very poor compensation for those insurances. So, for example, at the office I worked at, a typical office visit cost $80. For a patient who had medical assistance, of that $80, the insurance only reimbursed the physician $4. The other $76 went back into the pool to pay for people's insurances. So a lot of physicians end up losing money when they see a lot of patients with government assistance insurance. Medicare is not quite the same because usually patients who have Medicare, it's a different payout. But medical assistance, Unison, and Medicaid are ones with very low payouts, or reimbursement is what it's called. So that's why some offices choose not to accept those insurances. Managed care is another kind of insurance, and this one is a good one for healthy poor people, to kind of put it that way. What that means is managed care insurance plans are usually a little bit cheaper because they restrict you to certain things. So in 1 year, you can go see your family doctor twice. You can go see a girly doctor once if you're a girl. You can go for a mammogram once. You can go, like, that kind of a thing. So they set limitations and restrictions. You can get blood work done twice. And as long as you stay within those confines, you're fine. If you go beyond that, though, then you have to pay for the full amount. So let's say that's the year I happen to be sick, and my managed care plan says I can only go see my family doctor twice, but I need to go a third time because I have bronchitis. Well, that third visit, I'm going to be paying for the entire thing all by myself, out of pocket, because it's beyond my contract. A managed care plan, kind of like an HMO, also decides where a patient can go for services, but the main thing about managed care is that it sets a limit to how often in a given year someone can go for services. Okay, so those are the most common types of insurances. If your head is already spinning, this is a good place to take a big deep breath. Pause me, stop me, and walk away, because now we're about to get into some insurance terms that you're going to need to know. So the next few slides basically are all slides full of definitions, but I'm going to explain them as we go, so don't worry. Okay, so the first thing that we're going to talk about is something that's called a premium. So a premium, regardless of what kind of insurance you have, whether it's managed care, HMO, PPO, a premium is basically like your monthly payment just to have the insurance. For most people who get insurance through work, sometimes this is taken right out of their paycheck. Sometimes they pay a portion of the premium, and then work pays the rest. If someone is unemployed and they have a plan by themselves, then they're paying the entire premium all by themselves. So it's just like a car payment you pay every month. So every single month you pay a car payment just to have the car, but that doesn't include the money that you shell out for tires and gas and oil changes and windshield wiper fluid, new wipers, floor mats. You get the idea. So a premium is basically just the monthly payment to have the insurance. That's it. If you go to the bottom and go to the word deductible, a deductible is a type of out-of-pocket expense, and it's called an out-of-pocket expense because you have to pay for this out of your own pocket in addition to the premium. So it's kind of like the deductible is the gas that has to go in the car. It's an out-of-pocket expense. The deductible and the premium, though, if you think of a scale, I'm going to try something, and I don't know if this will work. I wanted to turn my camera on so you can see me. But let me try and do it this way. I'm thinking as I'm recording. Yeah, I know. Here's dead air. It's a good time to go get a snack. Okay. Well, hopefully I can just do it this way. Imagine that you have a scale where you would put something on one side of the scale and the other side would get higher. And when you take, like a teeter-totter kind of a thing. Okay, so think of a teeter-totter on a playground or a scale. A deductible and a premium are tied together. They kind of depend on each other almost. So, a deductible is an amount that a patient has to pay out of pocket, and it's a set amount that you have to pay every single year before the insurance will kick in 100%. So, for example, if I have an insurance with a $500 deductible, then that means any tests or any office visits or blood work, anything that I get done, I have to pay the first $500, and then the insurance will cover everything else 100% for the rest of the year. So here's where the teeter-totter comes in. The higher that the deductible is, the lower the premium. So, if I have a $2,000 deductible, then my monthly payment is going to be lower. If I have a lower deductible, my monthly payment is going to be higher. So, for example, when I was between jobs, I took out an Aetna PPO plan by myself. So that meant I was going to be paying the premium myself, not a job, and I had to pay all the out-of-pocket expenses. So, because my monthly budget was, X, I had to take out an insurance plan that had a low premium. So I had a really high deductible, but because luckily I'm healthy, I don't usually have to go for bunches of tests and doctors and hospitals and things like that. So the odds of me having to pay that entire deductible that year were pretty slim. Okay, so that's what deductible and premium are, and they depend on each other. Now we'll go back to the middle because they're easier words. The insured or the subscriber is just the main person who's covered by the insurance, and then dependents are anybody else on the plan that the insurance covers. So, for example, let's say your father has insurance through work. He would be the subscriber, and then he adds your mom and you to the plan. You and your mom would be dependents on the plan. That's it. The eligibility, the effective date, and the expiration date. These two things are basically exactly what they say. So it's when the insurance kicks in and when the plan expires. So sometimes a plan will expire, and because a patient didn't renew the insurance, they couldn't afford it, whatever. You will have a lot of patients who will ask for certain favors when they get close to their expiration date, or they get close to the end of the year with their deductible, and may ask you to adjust a date of service to match their insurance. That is illegal. You cannot do that. So a fee schedule is what we were talking about with the PPO plan. It literally is a schedule that breaks down certain fees of what you will pay for, whatever service based on whether you see a doctor in the network or out of the network. So an office visit might be $50 if you see a doctor in network, or $75 if you see one out of network. And that's what the schedule is. Your insurance company provides this to you when you sign up for the PPO plan. You don't get a fee schedule with an HMO because the prices are set. The insurer is just another name for the insurance company, like Blue Cross Blue Shield, Aetna, First Priority, blah, blah, blah. Okay, so open enrollment. Now, this is a time of year where you are able to go into your insurance plan and make changes. So, So here at work, for example, here at Fortis, my insurance, we have 3 different options. So maybe last year I picked option A, and maybe this year I want a lower premium every month. So during the open enrollment period, which they notify me about, I'm going to go in and instead of option A, I'm going to switch my insurance to option B for this year. I can do that during open enrollment. Once that enrollment period ends, you're stuck with whatever you have. Okay? Most patients won't ask you about open enrollment. The biggest questions that they're going to ask you about are deductible. They're going to ask you those out-of-pocket expenses and EOBs, which are coming. Okay, so a copay. A copay is another type of out-of-pocket expense. So a copay is the money that you pay at the time of the visit. It's usually higher for specialists than it is for primary physicians, and sometimes it's listed right on the insurance card itself it might say OV and a dollar amount, in which case the price is the same for specialists and primary physicians. It might say PP for primary practitioner and SP for specialist, but the copay is the thing that you pay right then and there before it gets billed to the insurance. So the way that things generally work is that you go to the doctor for a visit, you pay your copay, the visit gets billed, and then you get a bill in the mail for any deductible that you might have to pay towards that visit. So now we have, so far for out-of-pocket expenses, we've talked about your copay and your deductible. A third type of out-of-pocket expense is coinsurance. Coinsurance is in addition to a copay and in addition to a deductible that you have to pay out of pocket. A coinsurance is determined by its percentage that you pay for certain services, usually for hospital kind of stuff. So for example, I got whacked with this. I had to go for a breathing test, and it was a 2-day breathing test. So because it was a hospital service, I had to pay a copay. So I paid my copay both days. Then they sent it into the insurance company, and I had a deductible. So for each day of the test, I had to pay $200 towards my deductible. In addition to that, because it was a hospital type of test, it was a hospital breathing test, I had to pay a percentage of what the services were. So I think on top of that, I still had to pay $150 or something like that. Basically, that by the time you added up all that out-of-pocket expense, that one test cost me like $600 or $700. It sucked. But I needed the test done, and it's actually helped me breathe better, but I was not expecting that kind of a bill. It was really rough. So a copay, or a coinsurance, is a percentage of the price of whatever the test cost. And the coinsurance, the percentage is set in the information pamphlet that you as a patient get when you get the insurance. Okay, so an EOB. An EOB is not a bill. It says on it everywhere, it is not a bill. This is not a bill. This is not a bill. This is not a bill. However, patients always think that an EOB is a bill. And usually they will get an EOB in the mail, and they will call you, and they will freak out and ask why you're billing them. And the first thing you need to figure out is if it's actually a bill or not. So if you have your textbook handy, if you flip to page 254, it gives you a picture of what an EOB looks like. And you can see right at the top, it says, "This is not a bill." An EOB does not come from the doctor's office. It does not come from the hospital. It does not come from the facility where the test was done. An EOB comes from the insurance company, and it's sent to the patient, and it lists the date of service, what was done, the diagnosis, how much it's going to cost, and probably how much the patient is going to have to pay. EOBs are sent out One, so that the patient can keep record of all of their medical expenses, because a lot of people who pay a lot into their medical expenses get it deducted off their taxes at the end of the year. Another reason is to help prevent insurance theft. So some people actually steal other people's identity and insurance. So if I suddenly get an EOB and I'm like, wait a minute, I didn't have a dental cleaning 2 weeks ago, I need to call my insurance company. There could be a problem. So an EOB is not a bill, it's not a bill, it's not a bill, it's not a bill. But patients always call panicking about these because the prices that are on EOBs are so high, because it shows you how much a procedure or whatever actually costs. Okay. A super bill or an encounter form. This is the thing that's filled out by the doctor's office. It usually looks like a chart kind of a thing. And it's filled out so that it's filled out with a CPT code and diagnosis code, so someone knows what was done and for what. They do have these in EMR programs. I'm looking at, there's no super bill picture in your textbook. I was hoping there was. There's a claim form, but I don't want you to look at that. But it's something that you might fill out. It's something the dentist might fill out. You're going to get more practice with this when we do the EagleSoft project. There we go. It's this super bill that gets sent to the insurance company to bill, or sent to the billing department to submit the claim to the insurance company. Okay. A COB stands for Coordination of Benefits. So this is when you have two insurance companies working together in order to provide full coverage for a patient. So this is the most common with Medicare. So patients who have Medicare, which is a government type of insurance, Medicare only covers 80% of what happens. So a visit, a hospital stay, whatever. The other 20% is usually left up to the patient. Well, people who have Medicare are typically over the age of 65. They're on Social Security or disability or whatever, and don't have 20%. So they could choose to pay the 20% out of their own pocket, or they get another insurance plan that just covers that 20%. So that second insurance plan would be a secondary insurance, if you look at the second bullet point, or a supplemental insurance. And both of those insurance plans work together or coordinate to benefit the patient. So, for example, my grandmother had Medicare as her primary insurance, meaning her main insurance, so that got billed first. And then she also had Blue Cross and Blue Shield. So, after Medicare got the bill and decided what they would pay for, the stuff that was left over would get sent into Blue Cross and Blue Shield, and Blue Cross and Blue Shield would pay the rest. Now, Medicare is a government insurance. Blue Cross and Blue Shield is not. So that means she had to pay the premium to have the Blue Cross and Blue Shield supplement insurance. It's sucky. Okay, where are we at? We're almost done. Look, we're almost done. It's not that bad. Okay, so a pre-existing condition is something that you already have that an insurance company can refuse to cover. So, for example, I told you about that Aetna plan that I took out by myself when I was in between jobs. And if you know me, you know I have a history of migraines that I've suffered with forever. So, when I applied for this Aetna plan, they ask you if they can contact your physicians and pull your medical records, and you have to give them permission to do it. So, Aetna sends me a decision letter. And they say, you can have Aetna insurance. However, migraines have been identified as a pre-existing condition. So that means that we will not pay for anything that relates to migraines. No office visits that even mention migraines. No medicines for migraines. no brain scans for migraines, nothing at all. But we'll pay for the rest. Usually this is what really aggravates people, because if I have a history of migraines, maybe I want the insurance so that I can go get tested for the migraines. This is a big selling point. You might have seen like Alex Trebek on those insurance commercials for old people, and they're like, no pre-existing conditions, you'll be approved, no health questions. This is what they're talking about. So if you have a condition prior to getting that insurance, the insurance can refuse to cover anything that has to do with that condition or disease, and it really sucks. Okay, pre-certification, which is known as a pre-cert in the medical world or in the billing world. A pre-cert is when a patient needs to have something done, but before you do it, you call the insurance company to make sure that the insurance company would cover it at all. So it's in advance, pre-certification. So let's say a patient is in your chair and needs a root canal. Before touching the patient, before scheduling them for the root canal, you're going to call their insurance company and get a written verification that the insurance company will cover the root canal for the patient. That's what a pre-cert is. Now, a pre-cert is different than a prior auth or a pre-authorization. A prior auth, even though it still uses the word prior and pre, prior auth is when an office proves to an insurance company that they have to pay for something because it's medically necessary. So, it's very common with medications. So, for example, imagine you have allergies and you go to the doctor and they give you Zyrtec to try. And the doctor looks at you and says, I know that Zyrtec is not going to work, but I need to document in your chart that you tried the Zyrtec, and I need you to call me in a couple days and tell me it didn't work. So then I can document that too. So this happens with the Zyrtec and with the Claritin, and then it happens with the Nasonex and the Astelin and the Patinase and the Zetona. And the only thing that's really going to work for you is getting allergy shots, but your insurance will not cover allergy shots. So, now because you've tried and failed all these other medications, the doctor's office can call your insurance company for a prior authorization, send them all the office notes saying, look, the patient has tried everything, the allergy shots are the only thing that's going to help, and then try and get approval for them to pay for something. So this is one of the things where even though a doctor has a lot of autonomy, insurance companies can take away quite a lot of autonomy for physicians, because a doctor might know, look, I know I need to give you this medication, but I can't order it because the insurance won't cover it. You got to go through all these hoops first. Okay, so an audit is when an insurance company comes in and looks at all the charts, whether they're electronic or paper, to make sure that everything is being documented and done the way that it's supposed to. So there's no fraud going on. The last word there is out-of-pocket expenses. I've said that word quite a bit so far. There are 3 categories that are in out-of-pocket expenses, and they are copays, deductibles, and coinsurance. The premium is not considered an out-of-pocket expense. So if we go back to that car example, your premium is your monthly payment, and your out-of-pocket expenses to have that car are gas, tires, windshield wipers, floor mats, oil changes, tire rotations, stuff like that. So in the insurance world, out-of-pocket expenses are copays, deductibles, and coinsurance. It's money that the patient will pay out of their own pocket in addition to the premium. And there is the same exact thing again. Holy moly, that's the end of the PowerPoint. But I want you to grab your textbook and flip to the end of chapter 14, which is page 255 through 258. There are a ton of vocabulary words. Some of them are repeated in that we've already talked about here. Some of them are not. If for the duplicates, if you like the definition in the book better than the way I explained it, yippee skippy. But do not panic when you see this huge list of terms, because the only ones that you are going to be responsible for are the ones that we talked about in this PowerPoint. This PowerPoint isn't necessarily something that you're going to need for your boards binder, but it might be something that would help you quite a bit once you get into an office. So it might be something that you want to kind of just tuck aside for when you're actually working in a dental office. Okay, everybody take a deep breath. You survived insurances. I think this is the most painful PowerPoint of the course, so if you survive this one, you're just fine. Make sure you ask me